Good afternoon, everyone. My name is John Beveridge. I'm the chair of the Working Toward Wellness Committee, Occupational Health and Safety Coordinator at Windsor Regional Hospital. I will be the Master of Ceremonies for this event. Welcome to the virtual recognition ceremony for the Healthy Workplace Awards 2020. Some of you may be more familiar with the traditional Gord Smith Healthy Workplace and Bike Friendly Workplace Awards. However, those were postponed and temporarily replaced with the Healthy Workplace Awards as an acknowledgement that traditional approaches to workplace wellness would have been impacted by the ongoing COVID-19 pandemic. The Healthy Workplace Awards 2020 program was created by the Working Toward Wellness Committee, the Windsor-Essex County Health Unit, Canadian Mental Health Association, Windsor-Essex County Branch, and Family Services Winsor-Essex to uniquely capture those new strategies and approaches that were being adopted by workplaces to operate safely while prioritizing the health, safety, and mental well-being of employees, customers, and the broader community. Thank you for joining us today as we recognize the efforts of 31 award recipients and highlight some of their proudest moments. Our agenda for the next hour will include a keynote presentation by Dr. Andrea DiNardo, the award presentation itself, and concluding with some closing remarks. A few short announcements before we get today's event underway. We would ask that you please keep your mics on mute for the duration of the event. If there are any questions or comments, we would ask that you please enter them into the chat box, and we'll do our best to answer those in a timely manner for you. Also, too, the graphics that you'll see in the presentation relating to the awards will be shared with award recipients following the conclusion of the event. This session will also be recorded, so feel free to keep your camera off if you do not wish to be displayed on video. So, the Working Towards Wellness Committee itself is comprised of individual members representing multiple sectors and organizations across Windsor-Essex County, including Michelle Suchu from Workforce Windsor-Essex and Windsor-Essex Local Immigration Partnership, Sarah Fram from Workforce Windsor-Essex, myself, John Beveridge from Windsor Regional Hospital, Jeff McEwen from St. Clair College, Melissa Ventura from New Canadian Centre of Excellence, Mark Parent and Melissa Statham from Occupational Health Clinics for Ontario Workers, Sonia Skillings from Green Shield Canada, Renu Kozla from Greater Essex County District School Board's Joint Employee Assistance Program, Judy Lund and Beth Ann Turnavin from Family Services Winsor-Essex, Debbie Kane from the University of Windsor's Faculty of Nursing, Kim Willis and Melanie Baker from Canadian Mental Health Association, Windsor-Essex County Branch, and various representatives from the Windsor-Essex County Health Unit. Any workplace that has a sustained interest in promoting and supporting the health and well-being of Windsor-Essex County residents through comprehensive approaches to workplace wellness is welcome to join this committee, as each member provides a unique perspective and contribution. The Working Towards Wellness Committee was established in 2002 to promote and support workplace wellness efforts in Windsor-Essex County by providing input into the planning, development, implementation, and evaluation of comprehensive workplace wellness programs. The committee also organizes the Healthy at Work webinar series, which many of you have attended, oversees the Living Wage program, and hosts the Gord Smith Healthy Workplace and Bike Friendly Workplace Awards. As we've mentioned, this year's version of that is the Healthy Workplace Awards. And recognizing the importance of prioritizing workplace wellness, especially during this pandemic, I would now like to take the opportunity to introduce our keynote speaker. Dr. Andrea DiNardo is a psychology professor, author, and TEDx speaker who applies positive psychology to cultivate mental health, resilience, and transformational change. Her psychology blog and TEDx talk, both called Thriving Under Pressure, were created in response to rising levels of student stress and anxiety. The purpose of both is to help people develop sustainable resilience techniques in fun, interactive, and uplifting ways. We are excited to witness her talk on Catch, Pause, Repair, CPR, work for sustainable resilience. Dr. DiNardo, the floor is now yours.
Thank you. Can you hear me okay?
Yes.
So as you're working on that, I have 9 minutes and 10 seconds, which is never a problem for me because as a psychology professor, it's really important that I capture the attention of my students. And I need to do it now in 15 seconds or less because of social media, everything it's you know, I gotta get to the point. I started practicing as a psychologist. I'm a retired registered psychologist. I practiced for 18 years and my specialty is counseling and school psychology. And what I've always been interested in is taking care of the entire population. I've always had a real interest in resilience and I've always had a real interest in prevention. And one of the reasons I've had such an interest in that is all of you know, you're all working in health and wellness. People don't necessarily come to you when they're having a great day. And what I learned early on as a young psychologist was that I had to protect myself first. And really the early models of psychology up until about 1999 were all about what's wrong with you. And I've always been an optimistic, hopeful person, and I don't necessarily see problems, I really just see opportunities for change. But there wasn't a big model around that early on in psychology, so I started to turn to positive psychology. And I had an opportunity, I was started teaching at Western in London during graduate school to pay my way through, and I never really wanted to be a teacher. I just wanted to be a psychologist in the school system. And I moved to Windsor in 2002 to work at the Catholic Board, and an opportunity came up at St. Clair College. So I absolutely love what I do because I have the opportunity to bring psychology to everybody's lives. And so I'm going to give you a snippet on For You. This is all about you and how the next time you're in a situation that you are overwhelmed, that you are overreacting to something and you don't know what's happening. And so what I'm going to talk about is my model, which is called Catch, Pause, Repair. So we know about CPR in health. What about emotional health? And I truly believe in simple things on repeat. To me, that's sustainability. If you can't do something with your children, with your spouse, with yourself that's repeatable every single day and it's practical, you're not going to do it. So CPR is a simple way. So what I'd like all of you right now to do, you can write it down, you can think about it, but in the last week, what is something that has triggered you? And when I say trigger, you find yourself outside of your body, that stress and anxiety is very physical and you can't think rationally. And most likely what you're having is what's called an amygdala hijack. And what happens when we're in a state of stress or anxiety, everything goes down to the base part of our brain and we go into fight, flight, or freeze. Essentially your IQ goes from 100 to 0 in 5 seconds flat. And so we all have, you know, buttons that are being pushed, okay? You're gonna say it's your spouse, right? You're gonna say it's your kid. You're gonna say it's COVID. But whatever it is that triggers you in the course of a day, and it could have been traffic already today, it could have been Skype, it could be any of those things. The first C is catch. We wanna catch ourselves before we escalate. It is perfectly normal to have overreactions throughout the course of a day. But we want to get to the point that we catch ourselves before it escalates into a text that you don't want to send, into an email that you don't want to send, into an encounter with somebody. And part of it is really about what part of it is being compassionate with yourself. And so this is what I love about what I do as a professor, because a big part of what I do is I teach about abnormal psychology, and essentially everywhere we look, we think we're abnormal. We're actually very, very normal reacting to an abnormal situation like COVID. So if we catch ourselves before we escalate, and we have these sensations where we're not fully in our body, then what we can do very quickly is move into pause. Because in the space between the basement of your brain, which is your amygdala, your limbic system, and with me right now, you take a deep breath. It can take as little as 60 seconds of breathing space to get you from this panic part of our brain, which is an overreaction. You're not upset that there's not a parking spot. It's not about the traffic. It's not even about, dare I say, COVID. It's the fact that you don't have the resources to deal with whatever it is. And what ends up happening is everything piles up. So when we go from catching ourselves, okay, this is not me. I'm teaching full-time now online. And it was interesting at the end of the semester last year, because students, and we were all in an all-is-one situation, kumbaya, everybody was in it, right? And then in the summer, we went sort of from the panic into the sort of exhaustion mode, and because I teach in summer school too, and I was starting to get emails and reactions from people at work that I'd never experienced before. And so what I had to do is take a pause, because guess what? It wasn't about me. It wasn't even about the student. They were completely overwhelmed. And so CPR, as I go through it, and remember, this is like a Coles Notes version of it. CPR is a framework, here we go, is a framework for handling these situations when we're completely overwhelmed. When we're in this amygdala hijack, and this is a coined term by Dr. Daniel Goleman from Emotional Intelligence, that essentially there's a disconnect, because in our brain, in email, okay, think about an email that you received, and even in the title, in the first word, it was so much that you didn't even want to read the rest of the email because you were convinced it was going to be way too much. And then you go back the next day, after you've taken a pause, you read the entire email, you listen to the whole voicemail, and it was good news. But when you're in that catch position, we are being triggered. And for all of us, okay, we've been around a long time. We're in it, like, age gives us perspective, and this is a compliment. And so that something that may have triggered you at work is actually related to something that happened in your very first job. Something that triggers you in your spouse, with your spouse, Gordon, may be in fact about your mom and not your spouse. You know? So what happens is you go from, you catch yourself when you're overreacting, you take a step back, like a literal step back. And what's happening, like right now, right here, we're living in this world where there's not a lot of boundaries between us and the people around us. And so when I sit down to work at my computer, I put combat boots on. And that's one way of me grounding yourself. So part of the pause is feeling more expansive, grounding yourself, going for a walk away from your computer. So often even in classes, I'll just say, listen, we're gonna take a 5-minute break and then I'll come back. But what I find in this pause, even in the regular classroom, and this may be you too, if you look to your phone right away, you're not allowing yourself to be more expansive. And when we're in threat, what happens when we're in this, where we need to catch ourselves, our vision actually narrows because we're going after the prey. So in our pause, one of the things that we do, and I talk about this in my TEDx talk, Thriving Under Pressure, is you literally want to look up, because what that does is expands all of you. And instead of this one thing that's triggering you, that I look beyond my computer and there's a full-blown 6x6 photo of my honeymoon in Bellagio, you know, in Italy. And so that reminds me that my life is way more than this moment. And then finally, the repair. These are things that take longer. And this is really about the work that all of you do. And that's where we can do an assessment. And I love Maslow's hierarchy because he's one of the very first proponents of positive psychology, is that we do a needs assessment and see what's within your control. And I'm going to tell you, for me, and I'm sure for a lot of you this is the case, it's mostly physiological. I need to sleep, and it's free. I need to have an almond or 20, or go for a walk around the block. And this is also too, maybe I'm feeling unsafe. One of the reasons maybe I was triggered at work by an email from a colleague, or maybe the way someone looked at me, because there's something in my work history where it's related to that, and it's an unconscious thing. And even in the classroom, when I'm physically in the classroom, and obviously when I'm on Zoom, or we use Blackboard Collaborate, I look at and pay attention to the students, you know, how safe are they feeling? So whenever I reply to them, I always remind them sincerely. It's one thing to have words, but we have to follow it up with action too, that their success is my success, that we are truly in this together, that I want them to succeed. And at the same time, if you're not feeling safe because you're overwhelmed with time, because they're doing a lot of their tests that are timed online, I give them the information to go to Learning Commons for all of those things. Because my background, 18 years as a psychologist, what I'm constantly doing, and this is another course that I teach. I teach mainly in the nursing program, in the cloud nursing program, and it's to help them understand, and you too, that our health is as unique as our fingerprint, and our reaction to health is as unique as our fingerprint. So if something's missing, these are called deficiency needs. Well, self-esteem, that's learning. Self-esteem, that's work, that's purpose. These are all growth needs, but you can't get to there until you've taken care of what's below it. And so a framework like CPR, what it does is it takes all the emotions that we're overwhelmed with, puts a framework on it, and you think, oh, that's what's happening. And why resilience is so important is because the way I see resilience is that, you know, say this is balance, no one's really always in balance, but with everything that's added to your plate, it's gonna just put you out of balance even more. And each of us has a different ruler, right? So for some of us, we can bounce back a lot more easily. And bounce back is the word in Latin, resilient means leap back. And for some of us, if it's stretched too far, we'll never get back to where we are. But my perspective on psychology has always been very positive. So that I don't look, honestly, for the most part, I don't look at COVID as the worst thing that's happened to everybody. For some people, it may be an opportunity for them to grow. Now, if we go through personal trauma, there's a lot of blame and shame around it, but you did nothing wrong. We did nothing wrong. That this is an opportunity for us to actually grow our strengths. How many of you out there on the other side of the screen never knew technology the way you did and the way you do? In 2015, I was so overwhelmed by the level of stress in my students' class, on my classes, and I, you know, throughout the year I have as many as 500 students, that I had to start writing about it. So I have a psychology blog now, and I have 200 posts up there. And I also started a YouTube channel probably about 3 years ago. And so I have a ton of videos up there. And 2 years ago, I was actually teaching online. None of those things, especially teaching online, I wanted to do, but all of it allowed me to have more than one red umbrella. And that applies to Kim, to Gordon, to John, to Dr. Phil, to Brian, and everybody else listening. So that resilience is a little different than mental health. Mental health adds to our resilience. And one of the reasons I got so interested in resilience and stress is because there's something called the Diaphysis stress model. And there are certain things that put us more at risk for mental illness. And stress is a big part of it. So I figured as a professor and as a psychologist, as a writer, if I could go in and teach people what was missing, because for the most part, there's absolutely nothing wrong with us. We were just never taught how to swim. We were just thrown into the water and expected to swim. And so we all have to take responsibility. And I expect the most out of all of us, but at the same time, I give you and me breathing space for our tough days too. But if we can catch when we're starting to be triggered, if we can take a step back and pause, and then your programs, the health and wellness programs, figure out what's missing so that by the time it comes or anything comes around in our life again, I'm triggered every single day, and I'm sure all of you are too. But the difference is I bounce back a lot quicker now because I have sort of the memory of things before. So CPR. We are so much more than our stress, and we're so much more than our triggers. So thank you for the opportunity.
Thank you very much, Dr. DiNardo. Are there any questions at all? Okay.
If they want to reach me, there's a contact page on, thank you, Kelly, my fellow professor. There's a contact page on my blog, so drandrea.com, Dr. Andrea DiNardo, We're Thriving Under Pressure. And I just really believe as a community that we learn from each other. So, and it's nice to see Kelly Henley, she's at St. Clair too. So, hello, Professor.
Okay.
Thank you.
This is a nice segue leading us into the awards presentation now. So we'll just wait till we get things queued up.
All set, John.
All right, thank you. The Healthy Workplace Awards, the 2020 version, the program recognized businesses, workplaces, and organizations across 3 categories, as you can see on the screen. So there was health and safety, mental health promotion, and organizational social responsibility during the and relating to the COVID-19 pandemic. In order to be eligible for these awards, local workplaces were required to demonstrate that they had implemented several workplace wellness strategies, focusing on promotion, awareness raising, education and skill building, environmental and administrative supports, and supportive policies. So available in bronze, silver, and gold, the Health and Safety Award recognized organizations that demonstrated a commitment to implement the appropriate measures in infection prevention, protection, and control during the pandemic. Available in bronze, silver, and gold, the Mental Health Promotion Award recognizes organizations that demonstrated a commitment to create socially supportive workplace environments and efforts to meet the needs of employees during the pandemic. The Organizational Social Responsibility Award recognizes those organizations that went above and beyond their normal operations to support the diverse needs of our community. In order to move the program along, we will now recognize the 31 award recipients. We'll do so in alphabetical order and share some of the highlights from their winner's statement. So, Banna, Bulimia Anorexia Nervosa Association, is a recipient of the Health and Safety Gold Award. During the COVID-19 pandemic, they have transitioned to virtual clinical service delivery for their clients, something that had never been done before in their organization. They are most proud of their ability to adapt to the new norm using a collaborative approach. Next, we have Canadian Mental Health Association, Windsor-Essex County Branch, who is both a sponsor and recipient of the Health and Safety Gold Award, Mental Health Promotion Gold Award, and the Organizational Social Responsibility Award. They established a pandemic response committee that was tasked with developing protocols around screening, cleaning, and sanitation based on the available best practices. CMHA also transitioned to a virtual model of care and offered the services of a pandemic response therapist and a workplace outreach worker. The Emergency Relief Fund was also established to support vulnerable populations. They are most proud about moving quickly to mobilize resources to ensure the health and safety of clients, staff, and the broader community. Cavalier Tool and Manufacturing is a recipient of the Health and Safety Gold Award and the Mental Health Promotion Gold Award. Cavalier stepped up to manufacture tools for hand sanitizer units and other items required in the healthcare and food production setting, in addition to making things in their workplace to ensure the health and safety of their workforce. Children First is a recipient of the Organizational Social Responsibility Award. Children First provides individualized services to families and children from birth to 6 years of age who are at risk for or who are experiencing developmental and mental health challenges. They created a YouTube channel and use social media to share daily videos, message of support, ideas, strategies, and activities for families. These efforts have received positive feedback, and Children First is pleased that they are meeting a need in the community. Cimpress Windsor Corp, we know as Vistaprint, is a recipient of the Health and Safety Gold Award and the Organizational Responsibility Award. They are proud to have donated 100,000 face shields to healthcare facilities in small, underserved communities across North America, and 17,000 of those were donated to our local community. They also delivered 6,000 hospital scrubs with the mantra, "Together we are strong," printed on them for Windsor Regional Hospital. Community Living Windsor is a recipient of the Health and Safety Gold Award, the Mental Health Promotion Gold Award, and the Organizational Social Responsibility Award. During the pandemic, their top priority was to keep the people with intellectual disabilities, their families, and valued employees safe and healthy. They accomplished this by implementing no-contact pickup and deliver services and offering flexible work arrangements. Community Living Windsor is extremely proud of their team of essential workers and direct support professionals for their diligence and commitment to ensuring the health and well-being of the people they support. Data Realm is a recipient of the Health and Safety Gold Award. Their Human Resources Department, Management, and Joint Health and Safety Committee work together to create policies and processes that would raise awareness about the coronavirus, which help to ensure the safety of their employees. Data Realm is proud to have partnered up with a tech company and assisted with creating a temperature sensing device that is currently being used as a screening measure for those entering the building. They continue to work to foster an environment where employees feel safe and comfortable enough to share their and concerns. DC Farms is a recipient of the Health and Safety Gold Award and the Organizational Social Responsibility Award. DC Farms already had comprehensive health and safety procedures in place. However, these received a drastic update in response to the COVID-19 pandemic. DC Farms implemented environmental supports such as physical barriers, worker cohorts, and staggered work schedules, while providing administrative supports such as direct deposit, written policies, and training on how to use language translation apps for more effective communication. DC Farms recognizes the unique emotional difficulties that the temporary foreign workers may be facing during this time, and their response is to build an uplifting and rewarding atmosphere on the farm. Dion Orthodontics is a recipient of the Health and Safety Gold Award. At the onset of the pandemic, they consulted with colleagues around the world and elected to hire a medical engineering firm to review their air handling infrastructure in order to reduce the risk of COVID-19 transmission. Their risk assessment ultimately resulted in structural modifications to the building to ensure that the patients and staff felt safe in the environment while they continued to provide care. The Downtown Windsor Business Association is a recipient of the Organizational Social Responsibility Award. They have worked to ensure their membership remains safe and supported during these unprecedented times by distributing, reopening, and reconnecting kits, along with other resources to support business owners on their road to recovery. The Downtown Windsor BIA is proud of their efforts to go above and beyond to promote an optimistic, positive return to the workplace while addressing some of the most difficult challenges related to the COVID-19 pandemic. Essex Golf and Country Club is a recipient of the Health and Safety Gold Award. They use several resources to establish a new routine to work within the pandemic guidelines, focusing on increasing their cleaning practices and providing PPE or personal protective equipment for their staff. They are most proud of the strength displayed by their staff to adapt to the continuous changes. Something I think we've all experienced. Essex Power Corporation is a recipient of the Health and Safety Gold Award and Mental Health Promotion Gold Award. In response to the COVID-19 pandemic, they adopted new work-from-home policies, enforced limitations on customer visits, implemented safety protocols for employees, enhanced cleaning protocols, and prioritized the mental and physical well-being of their employees as indicated in their pandemic response plan. Family Services Winsor-Essex is proud to sponsor and also be a recipient of the Health and Safety Gold Award, Mental Health Promotion Award, and the Organizational Social Responsibility Award. During the pandemic, they actively continued to focus on their strategic priorities of investing in people, community, and the agency, which meant that health and safety was a priority in all aspects of their community-based work. They are most proud of their transition to remote work and online services, promoting EAP services, and offering a 24/7 counseling support line in partnership with the United Way. Great Northern Hydroponics is a recipient of the Health and Safety Award. They are most proud of their ability to provide unique support to temporary foreign workers by implementing safety protocols and policies. Organizing the delivery of essential items like groceries and personal products. Green Shield Canada is a recipient of the Health and Safety Gold Award and Mental Health Promotion Gold Award and the Organizational Social Responsibility Award. They are most proud of their commitment to avoid layoffs to the workforce during the earlier stages of the pandemic by refocusing efforts of their employees. One example was their partnership with the Windsor-Essex COVID Care Coalition to temporarily establish the Windsor-Essex Food Helpline, WEFH, to provide community access to emergency food. Habitat for Humanity, Windsor-Essex, is a recipient of the Health and Safety Gold Award. They are most proud of their Restore staff that reconstructed the work environment by installing barriers to keep employees safe. Their Restore staff also offered wellness checks for Habitat homeowners with immune-compromised conditions, delivered groceries to vulnerable populations, and supported the community by making masks. Harrow Health Center Family Health Team is a recipient of the Health and Safety Gold Award. They are most proud of transitioning to a virtual patient care model in a moment's notice, while still providing in-person appointments in special situations. Hotel Dieu Grace Healthcare is a recipient of the Health and Safety Gold Award, Mental Health Promotion Gold Award, and the Organizational Social Responsibility Award. They are most proud of providing mental health supports for their healthcare staff and patients during the pandemic. John McGivney Children's Center is a recipient of the Health and Safety Gold Award. They are most proud of being able to offer a mixture of both face-to-face and virtual services, depending on the unique needs of each family, as well as modifying the work environment so that it was safe for staff, employees, and their clients during the pandemic. Orange Line Farms is a recipient of the Health and Safety Gold Award. They are most proud of being able to offer essential worker pay premiums to all employees and are grateful to all the employee family members who spent the time and effort to make face coverings for the employees of the workplace when there was a PPE shortage. Seasons Retirement Communities is a recipient of the Mental Health Promotion Gold Award. They are most proud of being able to offer free and confidential access to mental health services so that their team members were encouraged to seek out new knowledge or help if and when they needed it. Seasons Retirement Communities is proud that they were able to swiftly introduce a pandemic pay increase well before the government programs, in addition to other morale boosting initiatives like their Frontline Hero button and a Little Extra Love Notes campaigns. South Essex Community Council is a recipient of the Mental Health Promotion Silver Award. They are most proud of being able to quickly adapt to continue serving the community's most vulnerable populations by providing meals and wheels services and offering check-in calls to isolated seniors and clients. St. Clair College is a recipient of the Health and Safety Gold Award, Mental Health Promotion Gold Award, and the Organizational Social Responsibility Award. They are most proud of transitioning their Sportsplex and Healthplex into local field hospitals and for donating PPE and other medical supplies to local hospitals in need. The City of Windsor is a recipient of the Health and Safety Gold Award, Mental Health Promotion Gold Award, and the Organizational Social Responsibility Award. They are most proud of redeploying a portion of their workforce to alternate work assignments to meet the needs of the community. They also distributed hand sanitizer to the community and medical items to healthcare facilities and offered day program shelters for homeless residents. The town of Amherstburg is a recipient of the Health and Safety Gold Award. They are most proud of their outstanding teamwork to respond quickly to keep their staff and the public safe while reopening local amenities such as the park and splash pad during the pandemic. They are currently working toward implementing an electronic screening tool for staff to use before coming into the workplace. Town of Lakeshore is a recipient of the Health and Safety Gold Award and Mental Health Promotion Award. They heightened the cleaning and sanitation of all municipal facilities, increased the number of sanitation stations, offered mental health workshops, promoted their employee assistance program, as well as tips of wellness and awareness to staff, and offered morning meditation mindfulness sessions. VON is a recipient of the Health and Safety Gold Award and the Organizational Social Responsibility Award. They are most proud of their resolve to continually educate clients, caregivers, community partners, and staff on the appropriate practices to reduce the risk of COVID-19 transmission. They have also supported the community by delivering food boxes and grocery cards to residents most in need. Windsor-Essex County Health Unit is both a sponsor and recipient of the Health and Safety Gold Award, Mental Health Promotion Gold Award, and the Organizational Social Responsibility Award. Most proud of being able to quickly respond to the pandemic by reprioritizing and redeploying staff to provide support to organizations' case and contact management efforts as part of the new COVID-19 team. The Windsor-Essex Community Housing Corporation, they are a recipient of the Health and Safety Gold Award. They reassessed, reconfigured, reimagined, and reinvented many activities to support staff and clients and coordinated wellness calls to vulnerable residents. The Windsor Family Health Team is a recipient of the Health and Safety Gold Award. They are most proud of being able to completely reimagine how they traditionally delivered care by establishing a pandemic committee, acquiring new technology to support virtual healthcare visits, and adapting health promotion services to various digital platforms. Windsor Regional Hospital is a recipient of the Safety Gold Award, Mental Health Promotion Gold Award, and the Organizational Social Responsibility Award. They recognize that the ability of an organization to achieve its objectives is dependent upon the well-being of all employees, and acknowledges that the key elements of a healthy workplace include the physical environment, health practices, the social environment, and personal resources. So congratulations. This concludes the acknowledgement recognition of the award recipients, 31 in total. We want to also take this opportunity to recognize other workplaces in our community. They've worked just as diligently to ensure safe environments for their staff, employees, customers, and the broader community during these unprecedented times. We must continue working together to ensure that health, safety, and mental well-being of our community continues to remain the utmost priority. For those who did receive, as I believe we mentioned earlier, there will be plaques available, digital award stickers, made available to you so that you can, if you choose, share them through social media on your designated websites, and then or something to display in the workplace. So there will be some email communication to each of you about that. So I'd like to conclude by saying that even though we have just gathered to celebrate these 31 recipients of these Healthy Workplace Awards, truly every workplace is a winner when we all focus on health and safety, as well mental health promotion and organizational social responsibility. So on that note, on behalf of the Working Toward Wellness Committee, we would like to thank the entire local business community for their extraordinary efforts to put people first. So enjoy the rest of your day, and thank you very much for your commitment to workplace wellness.
Thanks again, John, and all of you. Nice to meet you, and hopefully one day in person soon.
Yes.
DPR. Get that coffee in. Have a great day, everybody.
Yes,
Gordon.
thank you. You too.
Bye, Kim. Thanks for the invitation, everybody. I love living in Windsor, and this is one reason for it. Have a great day.
Thank you. You take care.
You too. You too.